Let's we go through one by one. Firstly, it is about normal conduction system. Then the introduction to the ST elevation myocardial infarction. Next is the criteria and the example of 12-lead ECG about the STEMI. And lastly, the treatment and management. Assalamualaikum and hello. I am Shaheera Afiqah Binti Subri with student ID of 012023 091933. I am taking electrocardiography subject and this video is for my final project. The conduction system begins at the SA node, which also known as natural pacemaker. From the SA node, the depolarization current spread through the right atrium and passes to the left atrium via Beckmann's bundle. The impulse then passes to the AV node through internodal fibers. The atria and ventricles are isolated electrically, and the electrical impulses can only pass from the atria to the ventricles via the AV node. AV node conduction is characterized by a conduction delay, which ensures that ventricular contraction occurs after the atria empty its blood into the ventricles. From AV node, a depolarization wave passes through the bundle of His, then passes through the left and right bundle branches and Purkinje fibers. The action potential is then reached the ventricular cardiomyocyte, which then contract and generate the force needed to pump blood throughout the body. Mr. Ahmad was walking in the park when he suddenly felt a sharp pain in his chest. He started sweating a lot and found it hard to breathe. He stopped walking, clutching his chest, unsure of what to do. What is ST elevation myocardial infarction? It is a type of heart attack occurs when blood flow to the part of the heart muscle is completely blocked, leading to the transmural ischemia and necrosis of the myocardial tissue. So what is the causes of STEMI? Firstly, atherosclerosis. It is a narrowing of arteries caused by progressive build-up of plaque. Secondly, spasm. It is sudden temporary tightening of the artery. And lastly, embolism. It is clot or debris formation blocks the arteries. So let's move to the pathophysiology of STEMI. Firstly, the plaque in the artery ruptures, exposing its content to the blood. This triggers platelet aggregation and thrombus formation. Next, the clot blocks the blood flow, leading to the ischemia, which is the oxygen deprivation in the downstream myocardium. Lastly, the entire thickness of the myocardial wall in the affected region becomes ischemic. If untreated, it progresses to the irreversible myocardial cell death, which is necrosis. The first example of 12-lead ECG about STEMI is anterior wall ST elevation myocardial infarction. So in the ECG, the ST segment elevation in the anterior leads V1, V2, V3 and V4. The reciprocal ST segment depression in the inferior lead, which is lead 2, lead 3 and AVF. So this would point to an anterior myocardial infarction, which is the blockage occur in the left anterior descending artery. Next is inferior wall ST elevation myocardial infarction. The ECG shows that ST segment elevation in the inferior leads, which are lead 2, lead 3 and AVF. The reciprocal ST segment depression in the lateral lead, which is lead AVL. So this would point to an inferior myocardial infarction, which is the blockage occur in the right coronary artery. Lastly is lateral wall ST elevation myocardial infarction. The ECG shows that the ST segment elevation in the lateral leads, which are lead 1, AVL and V5. The reciprocal ST segment depression in the inferior leads, which are lead 2, lead 3 and AVF. So this would point to a lateral myocardial infarction, which is the blockage occur in the left circumflex artery. Let's move to the treatment and management. For the initial management, firstly, nitroglycerin. It can relieve chest pain from blockage and reduce preload by widen the blood vessel. Next, aspirin and antiplatelet medication can reduce the formation of blood clots on the plaque in the arteries. Then, the beta blockers can reduce myocardial oxygen demand. Lastly, pain medication like morphine helps to reduce severe chest pain. For the reperfusion therapy, firstly, primary percutaneous coronary intervention, which is PCI, angioplasty and catheter are used to open blocked artery, often with stent placement. Then thrombolysis, medications like alteplase is used to dissolve the clot.